You were a medic and nurse for the Army. What is different in caring for someone one-on-one in the home compared to what you did with the Army?
A lot. So my scope of practice with the Army was much, much wider than it is civilian side. As a nurse and a medic with the Army, I could do pretty much anything. If I've been trained to do it, I can do it. I did intubation, I did suturing, I did, I almost said trachs. Not the trachs, I did crikes, where you have to cut here and insert an airway, either because their throat had closed up or there was a traumatic injury or whatever. So I implemented temporary trachs. I had to do the cut and insertion and everything. The big difference in the care with the Army, besides the scope of practice, is probably the patients themselves. Soldiers overall tend not to be real whiny until you get one that is, and then they're super whiny. But one thing I could do on the military side that I can't do on the civilian side is tell the overly whiny patient, "Oh, be quiet. Just stop. Nobody's interested in listening to you whine and complain. Just stop." Because they would, whine and complain about literally everything, the ones that did. But then on the opposite end of the spectrum, which is a lot of your soldiers, wouldn't complain about anything. And getting them to spill their symptoms was like pulling teeth. Like, where's it hurt? Oh, it's not that bad. Not what I asked. Where? Well, it's my foot. Okay, which foot? Well, the left one, but it's really not that bad. Okay, well, if it's not that bad, why are you sitting here in my ER? Let me see your foot. Oh, you've got a giant gash in the top of it. Okay, we need to clean that out and stitch it up. Well, I told you it wasn't that bad. I guess relative to missing a foot, it's not that bad, but dude had a gash on the top of his foot, probably 5-6 inches long, a couple wide. He had dropped a piece of sheet metal while he was barefoot. I told him, I said, "You're lucky you didn't slice your foot in half." He said, "Well, then I'd have something to complain about." It's okay to be in pain. So trying to get the soldiers to find that happy medium of, you don't have to bottle literally everything up, and you don't have to whine about literally everything. Let's both of you come towards the center here. Tell me what's wrong, where it hurts, when it's wrong, things I can fix, things I can do. Not to mention, because I did a lot of work, not just in the field, but in the hospitals too. And those are two completely separate entities. Field work it's quick, it's dirty, it's bleeding, airway, move. Because you need to get them to a higher echelon of care. So you do what you got to do to fix what needs to be fixed where you're at. If that means cutting an MRE package apart into a square and using tape to make a one-way valve for a sucking chest wound, you do that. If that means using one of the tampons you have in your medic bag to plug a bullet wound, you do that. And then you get them to the hospital and let other people take over. But caring for civilians one-on-one, it definitely has its pros and cons. A lot of it depends on the patient and the patient's family. If the patient's pretty chill, there is nothing I would rather do than help them out with whatever. I like the one-on-one care because versus working in a facility where I've got 30, 40 patients, I can't spend any time with them at all. Like, I have to run in, give meds, run out, because I've got so many people I'm responsible for, which is not how nursing should be. We can't take care of our patients the right way when they pile 30 and 40 patients on us at a nursing home. It's impossible. The hospital, at least the military hospitals, were a little better. I haven't ever worked in a civilian hospital, but I much prefer the private duty one-on-one. Like I said, when I have a good patient, like Andrew, when the patient has a good family, it can make or break private duty nursing. If you've got a family member that is whatever, there's personality issues with the nurse or other things, it can make you dread going to work every single day. Or if the patient is not the most easy to get along with, because I've worked with a few of those. Actually, I tend to get the more difficult cases simply because of my personality. It takes a lot to rile me up. But when I get there, it's fun. But I tend to get a lot of difficult cases because of my personality. But having a difficult patient can be a pain too. As well as, trying to understand where they're coming from with their disease process or injury or whatever, and knowing why they're being difficult, trying to help them through that difficulty without being drawn into the negativity and everything too. It's a difficult balance.